Brazil. His work centers around the construction of national identities, and he has worked with various communities and groups, the Asian Brazilians, the Arab Brazilians, and the Jewish Brazilians. His book, Immigration, Ethnicity, and National Identity in Brazil, with Cambridge University Press, examines the immigration to Brazil of millions of Europeans, Asians, and Middle Easterners from the 19th century onwards. He is also the author of a very prestigious award-winning book, A Discontented Diaspora, Japanese Brazilians and the Meanings of Ethnic Militancy. Welcome, Professor Lesser. Dr. Raj Baduel is an economist. She is based in Dominica, the Caribbean. She has taught extensively and researched at various universities in Africa, the Caribbean, and Canada. She has worked with the UNDP, the United Nations in Africa, on the ground as well as at the headquarters as a senior economist for over 3 decades. Her areas of research interests are gender and development, labor markets, international migration, migration and natural disasters in the context of her home, that is Dominica. Dr. Camila Tegao is a political scientist and read at the National Autonomous University of Mexico, acronamed as UNAM. She was awarded a diploma in international journalism from the School of Journalism in Denmark. She also did her postdoctoral research on scientific diplomacy. She currently works at CSAN as a researcher on skilled migration. We look forward to hearing from you, Professor Camilla, and I hope you will tell us more about your organization, acronym CSAN. Dr. Sandhya Rao Mehta is from closer home in Oman. She teaches at the Department of English Language and Literature at Sultan Qaboos University in Muscat, Oman. She's an alumnus of Delhi University and read for her master's and MPhil here. She completed her PhD doctorate degree at the Himachal State University in India. She has published mainly on teaching English language, and she has published very reputed work on diaspora studies and on migration from a gendered perspective, include and as well as on post-colonial fiction, with a focus on the Indian diaspora in Oman, where she is based. She's the author of Language Studies, Stretching the Boundaries, and an excellent book called Gandhi in Bombay Towards Swaraj with Srimati Usha Thakurji. She is also the editor of Exploring Gender in Literature of the Indian Diaspora. Welcome, Dr. Sandhya. We have two colleagues from Africa. Dr. Faiz Omar Muhammad Jami is a professor. He's a Sudanese national. He has a UNESCO Chair of Peace at the University of Bahri, Sudan. He also heads the Department of Scientific Affairs in his home country. Dr. Bahija Jamal is from Morocco. She's a professor of international law and international relations at the Hassan II University in Casablanca, Morocco, which is located on the coast of Mediterranean and Atlantic. She has worked with various international UN organizations like the UNHCR, the ICRC as a UNESCO. She also worked on various issues of forced migration, that is of refugees, asylums, migrant women and human trafficking, as well as counterterrorism. Professor Jamal is the president of an NGO, Horizon, that has worked for the protection of victims of human trafficking, which in association with the IOM. Welcome, Professor Jamal. So should I move on to the context and give a brief backdrop to our conversation and the questions today? And I would request all our speakers to speak for 7 minutes and give their views. So today, friends, we are passing through unprecedented times. Images of Christ the Redeemer in Rio, an iconic tourist spot, and where the Christ is wearing a mask is truly unbelievable and disturbing. Today, we will discuss the COVID-19 scenario and the aftermath of it with specific reference to the disruption of livelihoods, which is also being debated globally. Briefly, the key question or the dilemma today that we discuss is how do we save both lives and livelihoods? Here, I'm clearly referring to how do you kind of balance the stringent lockdown measures which have been imposed in various countries and also restore the livelihoods of the most vulnerable people. How do you protect income security, food and supply chains of essential commodities, general welfare, as well as the access to health of our population? I'd request and of course, context is central here, key to the control for any pandemic. there is no one size fit all formula. What works for Brazil may not work for India. What works for Morocco may not work for Sudan. So kindly share your views given on the strategies for both saving lives and livelihoods from the geographic context or the research context from where you come from. Do you think that the lockdown approach can save livelihoods? Do you think what could be the ways where we can save our livelihoods and protect the most vulnerable migrant and immigrant population in the countries from where you come from or you research? Very welcome. First, could I invite Professor Lesser from USA? Professor Jeffrey Lesser?
Good morning, good afternoon, and good evening to everyone. I hope everybody is healthy and staying safe, and I can say the same for your colleagues and families. My research is on health and migration in Brazil. Brazil for hundreds of years has been a country of immigration, and prior to that was a country of forced migration through slavery. The neighborhood where I do my research is a neighborhood in Sao Paulo, Brazil, one of the largest cities in the world, where immigration has been constant for getting on now 150 years. It started in the 19th century with European Christians, was followed by European Jews, and most recently has migrants from the Andes in the Americas, Korea, China, and increasingly South Asia. The way I do my research is partly historical and partly ethnographic. And for 6 years, my research team and I have been embedded in a health clinic in the neighborhood where we do our research. This is a particularity of Brazil in that the country has a national health service and has had one since the return to democracy in 1988. And the health service emerges out of a constitutional comment that health is a human right. This is certainly something unusual for somebody based in the United States, where health is a purchased commodity. So it's very interesting that in Brazil, anyone who's on the territory has the right to health. The question of documentation or other such things isn't really part of the question. The work we do is largely with immigrants who work in informal factories that are involved in the textile industry. These factories are largely in what had been residential buildings, and these buildings have now been transformed into what in English is called a sweatshop, which means that they're set up in that they have rows of sewing machines primarily, and around the sides of the space are rooms, and in each room an entire family lives. And there's a sharing of things like wash facilities and kitchen facilities and things like that. That means when we put all this together, it means the impact of COVID has been quite diverse on the lives of immigrants. On the one hand, because of the National Health Service and because of Brazil's long experience with epidemics, the National Health Service at the level of the ground, and this is different than what you're reading about in the media from the discourses of the president of Brazil, but at the level of healthcare workers on the ground on a day-to-day basis, has been very quick to respond, in part because COVID, in spite of its unique natures, in many ways fits into a long history of epidemics. As recently as 6 months ago, in Sao Paulo, we were dealing with a measles epidemic. Before that was Zika. Before that was dengue. And so that's meant that on a day-to-day basis, the national health system in the neighborhood has been very, very quick to react in very positive ways. For example, using the streets as part of the clinic, not just inside the building. Having an ability to know everybody in the neighborhood in what in the United States is now this new phenomena called contact tracing. In the Brazilian case, even though they don't have that exact word, in a sense, contact tracing has been going on for decades. So that's the positive side of the story. The negative side of the story is because of the nature of the informal factories, the spread of disease, both COVID and other ones, is quite common. For example, tuberculosis is a regular issue in these small informal factories. And that, together with the closing of Brazil's borders, has meant many migrants in the neighborhood that my team and I are doing our research in have either left Brazil, they've gone back to Bolivia, Paraguay, etc. In other words, places they've been able to go by land, which creates complete disruption. In part, they came to Brazil for both economic opportunity, albeit a very, very difficult economic opportunity, and the opportunity for nationalized health. But their fears of border issues and closing has meant they've left. It's a little bit different in the case of Korean migrants in the neighborhood, who on the one hand tend to be shop owners, and so are in a different economic situation. Many of the immigrants themselves came from Korea with a certain amount of capital, and so they've been able to work through the system. And many young Brazilians of Korean descent have entered into the healthcare industry. And so Korean Brazilians, especially those affiliated with religious institutions, often have access to an alternative network and alternative health network. And so there we're seeing this interesting give and take between a kind of ethnically based health network and a nationally based health network. And in the case of Korea, for example, it's very hard for migrants to return. This means airplanes and other things. And so the lockdown has meant that they're in local ethnic communities in Brazil, unable often to do their work. In my last 46 seconds, I'll just say that Brazil, like the United States, is in a kind of war with itself. Both Brazil and the United States have presidents who do not believe in science, who are focused on short-term re-election, even at the cost of lives of people. And this has created a lot of tension in which the words coming out of the mouths of health professionals and the words coming out of politicians are quite at odds with each other. And at the level of migration, it's emphasized because in Brazil, like in the United States, the federal political leaders often use language that appears racist. Thank you all.
Thank you, Professor Lezer. Thanks a lot for your insights. May I now invite Professor Raj Barduar for her comments, please? Hello, Professor Raj.
Okay, hi. Thank you, Madam Chairperson.
You have 7 minutes starting now.
Okay, all right. My research has been, most of my previous research has been on African migrants. I recently moved to my country, Dominica, and Dominica had gone through a couple of years ago, almost 3 years ago, a hurricane called Hurricane Maria, which had devastated the island. Almost.
Camera is not properly fixed. Camera, your face is not visible.
Okay, now I don't know how to do
No,
it, to be
just
very frank. I think my pad is okay. Is that
this
better?
okay. Fine, fine, fine.
I have to put it that way,
Yes.
this way. Is that better? Oh,
No,
no, it's not better.
no. This is
Sorry,
other
I'm
way.
handicapped.
Like this. This is fine. This is fine.
This is fine. Okay, I'll put some book behind it. All right. So the Hurricane Maria devastated the island, and a lot of people left. Almost. I will give details later. And there was destitution, infrastructure was damaged, economic lives were lost. There was just chaos. This was a very, very serious earthquake, serious hurricane. So then I said, okay, I'm sure this is going to impact the lives of, this is long before this seminar was organized. There was in December last year or early January that I'll do some work on the impact of continuous natural disasters in Dominica on the lives and livelihood of immigrants and society in general. So with that in mind, I started to go around to collect some information, which is in its infancy. And then, of course, COVID came, and in March, from the middle of March, we are in lockdown. So my field work is constrained. So whatever I'm going to speak is based on the secondary sources of data. And in fact, I'll be posing more questions and presenting any serious research analysis. A very Dominica is part of the Caribbean. Very 7,000 people, 72,000 people, like the last decade. The country has failed. So this exporter migration is here, more migrants outside the island, as in the case in the Caribbean, than population inside the island. So this then tells you that the opportunities here for migrants to come and work and live are rather limited. Now, recently, Haitians, after the 2010 earthquake in Haiti, some Haitians came to Dominica to work, and that work was on the land. Now, there are about 7,000 immigrants. So, well, they don't say immigrants, say 7,000 non-nationals. And these non-nationals can be people who are here just living and enjoying the sunshine, retired people from the UK, America, Canada, and so on. But real immigrants who come here to do some work are Haitians, or people who are affected by civil war in their countries, such as Syria, and political turmoil in Venezuela, as well as in other neighboring South American countries, has also attracted few people to come to Dominica. So out of the 70,000, roughly 4,000 are Haitian people, and they work on the land because the main source of economic activity in Dominica is agriculture, which still contributes 20% of the GDP, and a large proportion of the GDP comes from tourism, mainly from cruise ship tourists and eco tourists. Cruise ships have stopped since the virus started from middle of March, and generally too from March or April until September is not a tourist cruise ship season because it's hot. So this just coincided. So that's the other source which has impacted very badly. Now, coincidentally, as part of this debate, we recently got the information that employees of the cruise ships from different countries, they have been repatriated to their country. And so Dominica received 57, it's a small country, it has received 57 of its nationals to come back home who are in the quarantine. 2 of them were tested positive, the others are fine, but they're still in the quarantine. But this adds on to the already very serious economic situation in this country. Although migrants send money to their families, and most of them depend on that, about 13% of the households, they depend on remittances from abroad. And I have to hasten to add that the Dominican migrants are essentially those who have gone to initially to the UK because Dominica was a British colony. So essentially in the 50s and 60s, they went there and they settled down. And in the 70s, then they moved to the US, where they went as students or to work, and then to Canada, and then to, and of course, 25% of our nationals, they go to other Caribbean islands for a short time because there's free, visa-free entry to these islands. So that means the entry to the islands and finding work there is easy because they don't have to go through the administrative channel. So there's a lot of circular migration. The point I'm trying to make here is that because there is the movement of people in the Caribbean is such that it is very difficult to have data, comprehensive data on migrants who are abroad and data on migrants who are inside, because data collection capacity is very limited. So I cannot say with much certainty if there are 7,000 migrants here or 4,000 or 5,000, but the anecdotal evidence suggests that most of the Haitian migrants are on the land. They either lease a piece of land from the estate owners who used to produce bananas, and now bananas are not being exported because of the with the end of the Lomé Convention. Anyway, it's a long story and so on. So they work there and they are living on the land there, and so they're not affected by the COVID because they're in the open. Now, they're in the open, and their wives, they go to the market and they sell their produce for a little cash. Other Haitians, they have very small informal sector businesses such as sewing, they are good in tailoring. Others have small restaurants and hair salon and beauty salon. So we are talking about really a very low level of activities where they are eking out basically a very a marginal living, but the choice is limited for them because they can't go back to the island.
There's some audio problem. Professor Bardole, there is an audio problem.
Can you hear me now?
Yes, yes.
Hello?
Yes.
Okay, sorry. Okay, so as a result, we see that the island is not very attractive to immigrants. That's the point I'm trying to make, because of a narrow range of economic activities that the country has, basically agriculture, tourism, and tourism-related activities such as transportation and so on and so forth. So it's not that attractive, except if they are really stranded in political turmoil or in your safety that you come here, and it's a safe place. And in addition to that, the way the government has managed COVID here, we only had 16 cases because this was the question asked. We had only 16 cases of suspected COVID, and they were all quarantined. And this happened with one person coming from the United Kingdom and had infected. Out of those 16, 12 have recovered and they are part of the society, 4 are still quarantined. But as regards COVID here at the moment, we can safely say that there are no cases. We are still locked down. We are still under curfew, but for the last 2.5 months, and the government has managed this thing very well. There are community health workers, they come to your house to come and check if you have any virus issues. I was tested last week and we were surprised they came to your house. So it is accessible to immigrants or local population or whoever they are. And there's the community health service is very good, as is the National Health Service, which is free. It is accessible without any questions asked, without any documentation. So in terms of the safety of the people, protection of migrants and locals, I think the government has done very well. Now, how long it will last, because the money is running out, and the Prime Minister just said last week that things are very hard, expect layoffs in the public sector. expect live in the private sector and expect to live. And because the remittances have gone down, because the line that normally we see outside the Western Union have really reduced. In the past, if each time I passed in the morning, there would be people queuing up from 6 a.m. in the morning. See, there are only hours that you can get your remittances, which gone down according to the world, we all 20%. So the IS has been hit hard. We are not feeling the crunch at the moment because most people are still on the land, most people are still dependent on, and there is the safety net that the government has created in terms of safeguarding the population. And because it's an island, so really the needs are limited here, apart from basic foods, which is plentiful here. So coming to the point, to conclude then, in my conclusion, I will say, although my research is in infancy, but the questions we need to ask, and I'm sure it will appear in the discussion, is who really are the migrants in the case of Dominica? Are they returnees? Some of them who just came, and there's no plan for these 57 young migrants who were working on the ship, and I'm sure there will be many other countries. Apparently, there were 4,000 Filipinos who were stranded in Barbados on a ship that the government decided that they were going to charter on behalf of the company and send them home. And there are many 100,000 people who are floating on these ships. So this is a very issue. For us, there is temporary migration because of the free movement. People are going in and out of the islands. They stay for 3 months, they come back. They go back again, they go to the next island. So this is a highly mobile population, which for the last 3 months has been constrained by. So there's no movement of people coming in or people going out. So the economy people are feeling the pinch now. And soon it seems, it's simmering that there will be quite a bit of a problem unless the IMF or the World Bank comes to bail out the country. So the second thing I would like to say is that we need to have a discussion on the framework of analysis in the context of lack of data, when there's no data or comprehensive data, and when this COVID has just happened. Unlike Brazil, we have not experienced epidemics. This is a healthy place. We have experienced disasters which have had similar economic and social impact as any epidemic has, because it's almost every 3-4 years. So in terms of disaster preparedness, we are prepared, but in terms of epidemics, we are prepared in the sense that we have the health system and the population is small, it is manageable. But in terms of finding out where they are, these are small communities, so we can trace them and they can be isolated in case there are any problem, and they can be quarantined. There's one particular spot in the north of the island, in the south of the island, which is away from where most people live. That's the quarantine place. And it is not accessible to anyone except the staff that provides the service and the clinics. So in terms of security, I think this island has done very well. And I will take up the next, if there's any question or further information that people want to know. Thank you very much.
Thank you, Professor Raj. Thank you, Professor Raj. This is a really heartening note to hear that Dominica doesn't have and much issues. I mean, the double-digit numbers of COVID infected people is kind of a mind-boggling figure for people in India and other countries across the world. So thank you for this heartening note, and we will continue with your question-answer sessions later. Could I please invite Dr. Camilla Tigao from Mexico for her remarks for 7 minutes now? Professor Camilla?
Yes, I'm here. Can you hear me? Yeah.
Hi. Of course, you have 7 minutes starting now.
Hello.
Good evening. Yes.
Okay. Good morning here. Okay. So I will talk about the.
Hi.
Yes, I will talk about Mexican undocumented workers in the U.S. and how they became the essential invisible now these days. So normally I work on skilled migration, but today I'm going to speak about this what they are called unskilled workers. The purpose of this presentation is to analyze the impact of COVID on Mexican migrants in the US, which is, as you know, one of the biggest flows of foreign workers in the world in terms of absolute numbers. So Mexican migrants, both documented and undocumented, have been one of the most studied flows in the migration literature. You see there are entire libraries on the topic. So I will focus on Mexican migration in COVID times. First, I will give a bird's eye view of the overall context of the pandemics, and then go to the positive impact of COVID, and trying to be a bit optimistic today in spite of the terrible news that we have. So my point is, in all the crises, some actors turn out as winners. And in the COVID case, two types of migrants may have been particularly visibilized by the crisis. This is the undocumented agricultural workers who have recently become essential to the US economy, and medical workers. So let's go to the context. The bilateral cooperation under the pandemic between the US and Mexico. There are over 37,000 immigrants currently detained by ICE, Immigration Customs Enforcement, in more than 130 facilities across the US. Many of the detained migrants in the US are Mexicans. However, Mexico uses the same method to detain Central American migrants who try to cross the country to the US or to reside in Mexico. So what might have been a lesson for Mexican authorities is but a sad case of reproduction of the same methods of border externalization. At the beginning of the COVID pandemic, the US still returned migrants to Mexico, some of whom proved to be infected. These removals were part of the Remain in Mexico program, a previous agreement between Mexico and the US, according to which Mexico would keep asylum refugees while their cases are solved in the US. However, under present circumstances, the Remain in Mexico program can rapidly propagate the spread of the disease. Fortunately, the pandemic has also suspended many of the ICE's operations this spring. Since March 2020, ICE temporarily adjusted its compliance posture to focus on those undocumented immigrants who pose a threat to public safety. Visa processing from Mexico was also suspended. The border was closed to non-essential transits on March 20 in order to detain the spread of the virus. On the same day, the local government of Ciudad Juarez, one of the border cities in Mexico, also proceeded to shut down all non-essential activities. As a result, around 1,600 people currently staying at the shelters formerly recognized in this city. Many of them returned Mexican migrants, Central American asylum seekers, and refugees legally entitled to work in Mexico. They lost their jobs. So if they are unable to work, they cannot cover their basic expenses such as food and rent. Despite the measures on both sides of the border, more than 600 Mexicans have died in the US. The Mexican Ministry of Foreign Affairs set up a special program at consulates and embassies to support migrants and their repatriation of the remains of the victims. As of June 1st, however, so yesterday, Mexico has started the implementation of a system to reopen economic activities region by region based on local cases of COVID, a measure that may have its side effects on return migrants and asylum seekers, both positive and negative. So let's go to the case of agricultural workers in the US. They are now illegal, still illegal, but essential. Foreign workers, especially Hispanics and undocumented, seem to have been more hit by the crisis than the native ones. A study by the Pew Research Center shows that half of the households with Hispanic migrants, 49%, saw their wages cut or they lost their jobs due to the COVID breakthrough, compared to 33% of the Americas. Now, immigrant field workers were told to continue working despite directives to stay home, and letters were handed out attesting to their critical role in feeding the country. It is as if they suddenly realized that we are contributing, said one migrant, a middle-aged Mexican woman who has been working in the Clementine Forest south of Bakersfield, California. So what they say, migrants say, those of us without papers live with fear that immigration will pick us up. Now we feel more relaxed. The state of California is very particular. It has thousands of farm workers who attend strawberry, lemon, and avocado operation. They have offered $500 in cash as COVID aid to undocumented immigrants. So approximately 150,000 qualified for this type of assistance. And this is in fact an initiative also meant to retain those workers in the state. I'm quoting from a feature in New York Times. Sadly, it's taken a pandemic for Americans to realize that the food in their grocery stores or on their tables is courtesy of the mostly Mexican workers, the majority of them without documents. They are the most vulnerable workers. They are not hiding behind the pandemic, waiting for a stimulus check, said the owner of an agricultural business in the US. Alfredo Corchado, also a reporter for Dallas Morning News, who was an undocumented farm worker himself, also wrote on what he calls American hypocrisy regarding the illegal workers who are now deemed essential by the federal government. True to form, America still wants it both ways. It wants to be fed and it wants to demonize the undocumented immigrants who make that happen. By the Department of Agriculture estimates about half of the country's field hands, more than 1 million workers, are undocumented. Growers and labor contractors estimate that the real proportion is closer to 75%. So I will conclude now with a final thought. Suddenly, it seems that undocumented workers seem to be essential to food security and the US economy. In a similar way to agricultural workers, foreign healthcare is also essential to counter the needs of the pandemic due to a long-term lack of health personnel in the US, especially in rural areas. Despite their contributions, many of them are nurses benefiting from the uncertain deferred actions for childhood arrivals, DACA status, or are being banned from entering the country during the pandemic. So hopefully, this process of visibilization of essential workers will stay to improve the conditions of about 12 million undocumented migrants in the US. Many of them hope that the American authorities may change their mind about their situation, allowing them to access the so-called American dream. Thank you so much.
Thank you so much, Camelia. That was really a good perspective. And now it's heartening in a way that what was illegal and undocumented is essential. Maybe in the long run, there might be a change in the status of the Mexican immigrants, given their usefulness to the American society. Could I please take this small break and invite our eminent senior professors in the group to give their comments and remarks on the subject for a minute or two as they like. Could I please invite Professor Vinod Kadaria?
Yeah, thank you. It has been delightful to listen to these presentations on this important issue and in places where we normally do not put so much of focus, and particularly in terms of the Mexican migrants, particularly the invisible ones. And this is where I think new questions need to be raised in terms of the contribution that the healthcare workers are going to make, particularly under the COVID situation. So that, I think, is something, as you have also said, that there may be a paradigm shift now, that the illegals will become, the undocumented would become the essential ones. I think that paradigm needs to be pursued further and need to be brought to the mainstream of policy making. Thank you.
Could I please invite Professor C.S. Bhatt to give a short remark and his observations on the subject, please?
Oh, thank you for the invitation. It will be a pleasure to mention something about specifically the last paper. Is very, very interesting in terms of how the Mexican migrants have been treated in the United States. Now, to my mind, Mexicans have a very important role in so far as American, the street corner industry is concerned, like the food industry, for like the several of those industries are very essential to be maintained. This maintenance is done essentially by the Mexican industries. And she was mentioning about the California. You will find everywhere, you'll find restaurants and food industry mainly being supported by these Mexicans. So, immigrants' presence is very essential. COVID has given a very serious issue for the migrants are concerned, but then we need to see that some of the states which receives migrants need to take care of them. And, the minimal support which US have been given, say $500 she was mentioning, may not be really sufficient, but then I think some thing has been done by the US. I hope they'll be able to sustain that. Thank you. Thank you very much. This is the comment I have. Thank you.
Great. Thank you, Professor. Thank you very much. Now, could I please invite Ambassador Manju Seth? She served as ambassador to Mauritius, and maybe she has some comparative perspectives on small islands who can insulate themselves so fast, like Dominica, or any other perspectives. Welcome, ma'am.
Thank you so much. And it's a very interesting perspective that we've heard from all our speakers and in different countries. Yes, in the smaller countries, there is some isolation, but at the same time, migrants, I think, everywhere seem to be facing similar problems. This appear to be providing essential services, but at the same time, they are always looked at with suspicion and as taking away local jobs. And hopefully, and even in the times of COVID, they're being looked at as being carriers of the disease, because they're living in small spaces, and even countries like Mauritius, like Madagascar, and Reunion Island, and all these places in the Indian Ocean islands, they have also seen a fairly not large, but a fair number of COVID cases, and basically, they believe it's been carried by people coming back from other countries or by the migrant people coming in for work from other places nearby. But of course, the main problem is that their plight, the plight of these migrant laborers, is somehow ignored. Even in the times of COVID. But after COVID, I think, like as was just mentioned, in the Mexican case, migrants are being treated now, and maybe they'll be considered as essential. And maybe this will bring about a change of mindset in people, in various governments across the world. Thank you.
Thank you, Ambassador, for your comments. Can I take the opportunity to invite Mr. Paddy Sinyanga, if he has any comments to make on the presentations and his own observations, please?
Can you hear me?
Yes, of course.
Sorry about that. I'm having a problem with my computer here, so trying to trying to switch on the video. Thank you to all the presenters so far. I think it's been very enlightening. But like previous ambassador has just said, I think the situation that migrants are facing, it's quite similar in many respects. As the presentation was being made from Ms. Camilla, I'm reminded of how the impact of tourism, I guess, will become very important if I think of a country like the Gambia in West Africa that relies heavily on tourists. So I'm also interested to hear how that will how that would play out in the islands from the presentation that came from Raj as well, to expand a little bit on that. And I think we can always learn from how different governments, whether it's at central government level or local governments, subnational governments, the kind of support that they're giving in terms of allowing migrants to find a livelihood. Oh, there you go. The video is back. Sorry about that. I also think I also just wanted to say that it's also interesting to hear the role that the private sector begins to play even much more actively in this. And I'm also thinking about private actors. I'm also looking forward to hear how the diaspora has engaged in many other ways, whether it's diaspora that's close and near and far, as well as to hear what's going to happen around the intra-regional space post-COVID. So thank you very much for inviting me to say a few words. Thank you for the presentations.
Thank you so much, Professor Paddy. And can I now please invite Professor Nasra Shah from the School of Economics? Ma'am, we would like to hear your comments on the presentations and your own views.
Beginning because I was in another meeting, but fascinating so far.
Welcome.
Okay, one of the things is I was hearing about the Mexican case. I find that particularly for the undocumented in the Gulf countries with which I am most familiar, I think there's a contrast there. And undocumented workers everywhere in the world are the most vulnerable. And in the Gulf, they were able to survive really through their networks and through their resilience prior to the COVID. Now, but this idea of them becoming visible or them having to become visible, I think is an interesting one, where hiding is extremely difficult now. And so I don't see any category that would be like the agricultural migrant workers in agricultural Mexican workers in the US. But the idea that the undocumented have become visible is really a very interesting one. Thank you.
Thank you, Professor. Thank you, Professor. Thank you very much. I'll go back to our main presenters, three of them. Professor Sandhya Rao Mehta from Oman, who can carry forward the conversation that Professor Nasra just talked about, the migrants in the Gulf. Professor Mehta, we know that Oman is one of the 7 Gulf countries to which India has been sending many migrant workers for ages. And in Oman, Indian immigrants at one time comprised 20% of the population, so about 7 lakh immigrant population, which have declined over the years with the policy of Omanization and the crisis in the oil sector. And now the COVID pandemic will further hit the labor, the requirements of labor there. And we know that there are several of them are remittance senders of remittance to various states in India. And many of the migrants are from UP, Bihar, and Kerala in Oman. So what do you tell us about the future of these migrant livelihoods and how are we going to negotiate them in the years ahead? Thanks. So welcome, Professor Mehta.
Thank you. Thank you. I presume you can all hear me. So hello, everybody. Thank you to all the organizers, especially Dr. Sahu, who has brought so many speakers from different Is the speaker not working?
It's fine. We can hear you now.
Now it is okay.
Now it is okay.
Speaker is muted. Yes, now it is okay.
Okay, yeah. So anyway, thank you very much, Dr. Sahu, for bringing us all together for this very interesting conversation. I'd like to focus my talk on the present and continuing challenges for migrants in GCC countries, of course, with specific reference to Oman, which in many ways, as we have seen in the last hour, are confronting similar, but in some ways also very different issues also as we move forward. COVID itself has been sufficiently, officially at least, well managed in the GCC countries, mainly because of their centralized control systems. The present deaths, around 1,200 across all 6 countries, is a reasonable number given the circumstances. Airports closed and public gatherings stopped very early into this pandemic, in fact, by late March. But of course, these are official statistics which have to be viewed critically, because they don't really reveal the impact on undocumented workers or even women in the domestic sector who are currently invisible. Moving forward, the challenges are massive and unprecedented because we don't really have a template, and almost everything we say is really pure conjecture. Is that not clear? Because I see in the comments.
Yes, ma'am. It is not.
Okay, so is that better?
Yes.
Okay.
Now it is better. Yes.
Okay. All right. So, again, in case you didn't hear me, I was just saying that the political systems in the Gulf ensure that that COVID itself has been controlled fairly well because of the system, and because it was easier to have a lockdown. It was easier to control specific areas, and the 1,200 deaths in the GCC have to be taken a little more critically, because it doesn't really take into account the undocumented workers. So I will divide the economic and social challenges to the immediate present and to the sometime future. Currently, the focus in the GCC is on allowing migrants, basically workers, family, those on dependent visas or visit and tourist visas, to return to their countries, facilitated by flights organized by the sending countries. In fact, this itself actually almost blew over when the UAE government insisted that citizens of various countries be taken back on the threat of future trade deals. The reference was clearly to blue-collar workers who were either ill or had lost jobs and were considered to be health and economic liabilities to the state. It was only after mid-May that flights began to repatriate workers back to South Asia and Philippines, primarily the most prominent sending countries. Meanwhile, these workers have been living at close quarters in their camps, usually near construction sites. Many of them are unwilling to step forward to being tested, even if they were ill, as their visas may have expired or they may not have them in the first place. Very often, the public story is not actually what is happening on the ground. In Oman, for example, even though the government says that testing is free, there is a processing charge of 12 riyals, which is about 2,500 rupees. In fact, just yesterday, the government announced that 5 people had died outside the hospital. They may have been brought dead. The government has only been testing those with symptoms, relying more on broader lockdowns of entire areas to contain the virus. Insurance, who exactly is insured, has also become an issue, because nobody wanted to really take on the insurance of COVID testing. So the immediate result of all this is chaotic on the health and economic front. The scene will only become more clear when international travel opens up and companies begin to take stock of their individual industries and availability of funds. This already doesn't really look good. 27,000 jobs are said to have been lost in Oman in May. And companies are holding on to even their middle management staff with half of their salaries or suggesting that they avail of their annual leave. I'm just pausing because I see that it's not clear, so I wonder why.
It's better now.
Okay. So, so current data suggests that 27,000 jobs are said to have been lost in Oman in May. And companies are actually holding on to even to their middle management. With half of their salaries, as I said, many of them are being given loans against their gratuity. In fact, workers in various companies and the public sector are being told to leave as soon as they can, and that their gratuity, sometimes which goes back to even 30 years, in fact, would be sent to them later on. They simply don't have the money to pay. Of course, this also means that workers have not been able to send money back home, and in return, that has resulted in affecting the health, education, and livelihood goals in the receiving families. Even health workers have not been spared. Many private clinics have downsized, have actually downsized themselves as non-essential surgeries and OPDs have reduced. Nurses and contract doctors have also had their salaries reduced by 30% for the next 3 months. And this is only at the management level. For workers in construction and associated professions, the situation is dire as very few commercial activities have begun even after partial lifting of the lockdown. Many of these workers have been told that their contracts will not be renewed on expiry. This includes everyone in the economic hierarchy, from cleaners and electricians to those in IT, hospitality, and sales. The social and economic impact of these returning migrants, of course, will pose huge challenges to the sending countries. In the domestic sector, this situation is disturbing. Women working inside homes have been left in very precarious situations. With the lockdown, they have no access to the outside world, outside the families for whom they work. They have not been able to take their weekly days off, which they would often use to meet friends at the local church or the mall or temples, sharing maybe their fears or some survival tips. Throughout April and May, they haven't been able to send money home because the exchanges were closed. And in Ramadan, there have been reports of them being overworked with no recourse really to any action. As we know, domestic abuse cases have increased around the world at this time, and anecdotal indications suggest that this issue of women domestic workers in the Gulf, exacerbated by the fact that these figures actually are unlikely to really come out. As we all know, domestic workers are recognized as family inside the GCC system, so the NGOs and governments are largely powerless once they are integrated into a family. In any case, data also suggests that many women don't actually use the official channels established by governments, and their very existence remains under the radar. This pandemic will only anonymize them further. Once the pandemic settles and we go back to some kind of a new normal, the economic challenges faced in this part of the world are not going away. In fact, the simmering issues of low oil revenue, nationalization, and the powerful impact of social media will make the nature and the numbers of migrants change to a large degree. It's uncertain that the post-COVID GCC will be similar to the one we actually have just now. It's not clear whether the hospitality or the tourism industry, both of which are very important to both Dubai and many other GCC countries, will actually require the numbers which have been employed so far. Retrenchments are already taking place, and the full impact of that will only be clear once the dust settles, perhaps by the end of the year. The governments will look for ways to revitalize their economies in the form of employer taxes, and higher visa fees, imposing maybe even the VAT, which Oman has been very shy of doing, fearing backlash from its own citizens. The cost of all of this will, of course, be tapped to the various channels that migrants use. And this will make migrating more expensive and risky if we consider the loans and collateral usually taken before beginning the process of emigration. In the GCC, particularly in Oman, nationalization, or what is called Omanization, has come front and center in this patchy debate on the future of the economy. With a 40% population under 25 and 20% pre-COVID national unemployment rate, it's fair to assume that the few jobs which will be publicly available will be Omanized to the extent possible. The main reason this will happen is because of the power of social media, which now keeps a hawk's eye on recruitment by the government and is quick to treat any perceived injustices in employment. The impact of this may only be majorly in the white-collar jobs, but even that does have a trickle-down effect because customarily white-collar workers can use their own networks for recruitment down the line. That is unlikely to happen.
Professor Mehta, sorry,
Yes.
Professor Mehta, could you please conclude?
Yes.
Thank you so much.
Yes. So free visas may actually increase because the structural system which forms the kafala is unlikely to go away, and free visas actually benefit nationals, but put workers at immense risk, one they actually may be willing to take, as data suggests. So, but however, lastly, none of this will impact domestic workers as such unless nationals have less spending power, which is unlikely. The demographics of domestic workers, of course, has already changed from South Asia and the Philippines to African countries, particularly Somalia and Uganda. If sending governments do not ensure that women are going using official channels, it will be difficult to protect them. And again, the fear is that if there is a fall in demand, that will mean lower wages for domestic workers who are already at such a high risk of working in a foreign land. And we can look at some solutions later on. Thank you.
Thank you, Professor Mehta. As we can see, the situation in the GCC countries, including Oman, is truly dire. It has implications for the Indian migrant workers, and it is going to change. The GCC countries were a dream destination for many Indians, and now Indians will probably have to look inwards, the Make in India or more labor within the country than in international migration, because COVID has thrown up so many challenges across the globe. Thank you so much once again. And could I please invite our Sudanese colleague, Professor Mohammed Jami? Professor Mohammed Jami?
Webinar on the livelihood of migrants during this very yes, okay. Okay, can you hear me? Yeah.
Yes.
Yeah. Is it okay? Is it okay?
Yes,
It's
Professor,
fine,
yes, it's
fine.
fine, it's fine. Thank you to your son for setting it up.
Okay now. Okay, I'm just saying that I'm just thanking you, the organizers of this very important webinar on this very exceptional pandemic that has hit the world. I will be concentrating on 3 points. Point one about the pandemic and the spread of it in Sudan, as this is a country in the eastern part of Africa. And the second point, I'll be talking about who the migrants are in Sudan. And lastly, I will be talking briefly on the challenges that are facing the migrant workers in Sudan. In Sudan, many people believe that the virus was brought to Sudan by returnees from outside the country, from Egypt and United Arab Emirates in last March and April. Before that time, there were no incidents of infection by this virus or any other endemic. Those people who came from these countries were quarantined as soon as they have arrived. But then, unexpectedly, those people fled the quarantines. They fled. They ran away. Even returnees from Wuhan city, from China, who came to Sudan, Sudanese citizens there, also they fled the quarantines. Therefore, this is how the virus was spread in Sudan in the last 2 months. Now, about this outbreak of the pandemic has in fact impacted negatively all the citizens, let alone the migrants who are a vulnerable group. Who are the migrants in Sudan? Now, in Sudan, there are two categories of migrants. We can talk about the regular and the registered migrants. Those include people working for international companies and NGOs, notably from China, from Philippines, India, Turkey, and Bangladesh. And these also include students from Somalia, Nigeria, and other Asian nationalities. This is category one from the migrants. Category two includes irregular migrants in transit who used to take the route of the African migration route, which is mainly heading towards the destination Egypt and Libya. Apart from this category, we have also the refugees whose visas or residence permits expired are also among the irregular migrants in Sudan. These are the types of migrants in the Sudan, including those the refugees and including the workers who used to work for international companies and even international NGOs and the UN, of course, the staff who have also so many offices and sites working in. Now, about the challenges that is facing all these categories of migrant workers in Sudan, because this pandemic has resulted in very close and very tight restrictions for movement and a lockdown of the economic activity and a closing down of factories of so many industries. Mostly the second category, including the irregular migrants, are facing a very severe challenge of losing their jobs. This is a very high risk. They are facing the risk of loss of jobs due to the lockdown and due to the closure of the industries and the other economic activities. Because they cannot stay at home. Stay at home is not affordable for migrant workers because they are working on daily paid wages, and this is how they feed themselves. Apart from that, apart from the risk of losing jobs, the resultant also risk is also the remittances which those people used to send to their families in their countries of origin. Families of migrants and communities of origin face severe economic conditions and the exceptional drop in remittances as they used to live upon. So these are mostly the types of challenges that are facing those people, and we are seeing them. The first category of the regular migrants is is more or less okay, because the registered refugees have, the UNHCR is also catering for them. There are so many NGOs taking care of them, and so many subsidies and aids are given to them through voluntary work. Those at least are those irregular migrants who are not registered, and of course they are by far more than the registered migrants or the regular migrants. Therefore, we say that this negative impact is very severe on them. In fact, this one is one of the, of course, if this pandemic severe negative effects on the livelihood of regular citizens, it is by far also has very severe and negative effects on the migrant workers as vulnerable group. Thank you very much. Thank you for the opportunity. Thanks. Yes, very informative.
Thank you, Professor, for your comments. I can observe from and some you've said that the loss of remittances and loss of jobs is a global phenomena. And I'm also wondering about the post-COVID situation in the context of international labor migration. Will it lead to labor shortages in the traditionally labor-importing countries? And how will there be a recalibration of labor surplus and labor shortage countries in the years ahead? So, with these comments, could I invite speaker for the day, Professor Bahija Jamal from Morocco. Professor Jamal, very well, Professor Jamal.
I can't hear.
I'm here. Can you hear me?
Hi, Professor Jamal. Of course, we can.
Yes, we can hear. We can hear.
Hi, everybody. Hope you are doing well. First of all, can you hear me?
How will there be a recalibration of trends? Could I invite our Professor Jamal?
Yeah.
Hi, Professor Jamal.
Yeah, thank you so much, and thank you so much for inviting me, for giving me the opportunity to travel to another side of the African continent, which is the north of Africa. Morocco, as you know, is
shortages in the traditionally labor shortage countries in the years ahead.
Sorry? Is it okay or not?
Please carry on. It's okay. But
Okay.
it's okay.
Okay. As I said, let me share with you the experience of Morocco, I mean, at the age of the COVID-19. As I said, Morocco is, I mean, due to its vicinity to Europe, 14 kilometers to Spain, is one of the main migratory routes to Europe. Morocco, at the same time, is a land of migration, immigration, transit, and also a receiving country. So now we are under examination. I will explain why we are under examination. We are under test. As you know, coronavirus, I mean, that we are living now, is a test of society, of governments, of communities, and of individuals also. Let me, I mean, give more details about how Moroccan authorities have reacted, and the impact of the reaction on the livelihood of migrants living in Morocco. Let me, I mean, take as a methodology this dilemma of the balance between a security approach and the human rights-based approach. to what extent Moroccan authorities that until 2013 has adopted very, let me say, very human policy on migration and asylum, and now under examination to what extent Moroccan authorities are respecting their commitment vis-a-vis migrants living in Morocco. So we are under a state of emergency. To what extent we can really guarantee, the full enjoyment of migrants living in Morocco versus, as I said, security approach and human rights approach. What is happening right now in Morocco, particularly vis-a-vis migrants living in Morocco. So let me start by giving some facts about migration in Morocco. As I said, Morocco is a receiving, transit, and a source country of migration. As you know, in the literature of migration, it's too much difficult to have a really an accurate data about particularly migrants in irregular situation. But as I said, in 2013, we had a new policy, and one of the major, axis of this policy, it was that Morocco undertaken a process of regularization to campaign, exceptional campaigns of regularization of migrants in Morocco. And due to that operations, 50,000 irregular migrants were their situation is regularized. Now we have around 20 to 30,000 irregular migrants in Morocco. So we have 50,000 regularized. We have almost 30,000 migrants, undocumented migrants. We have 850 refugees. We have 6,015 asylum seekers. And as I said, Morocco now is really a receiving country of migrants and also for asylum seekers. Now, the situation, as I said, Morocco in 2013 has adopted what we call the human and integrated policy on asylum and migration. Under this policy, there were many activities. Let me say the upgrade, the legal and institutional framework in migration, asylum, and human trafficking. As I said, the two campaign of regularization of undocumented migrants and regularization of what we call here refugees who are already recognized by UNHCR, and they are finally regularized by Moroccan authorities, and many good steps. Really, let me say, we were at the golden age between 2014 and 2017, and after that there were a decline, unfortunately. One also of the main, let me say, measures taken by the Moroccan authorities is the adoption of a strategy of on integrating migrants and refugees in Morocco. This strategy is based on 11 programs, and one of these 11 programs that program to have access to healthcare, program of access to employment program, specifically to housing. And why I'm mentioning these three programs, because here now during the COVID we have problem of the implementation of this program. We have here, as I said, examination. We are under examination. We are under test. Moroccan government. To what extent really we guarantee these rights? I am all the time keeping this mind of international law professor from international human rights-based approach. This is how I am going to approach this situation. Now, these are the facts. Another fact that I want to is that Morocco is a developing country. In terms of, is a growing economy for sure, but we have limited, economy is too much limited, and we are even that undertaking many, considerable efforts to grow our economy. This is, let me say, a spectrum of the situation of migrants, situation of Moroccan. Now, and Moroccan policy also on migration and asylum and the refugees. Now, under COVID, what's happening? Since March 16th, really Morocco has taken really a preemptive strategy, to tackle COVID-19. Let me split it into big, trends. We have what we call restrictive measures. And sorry, is that a problem?
No issue, no issue. I think it's okay.
As I said, the Moroccan response to COVID, to tackle, the pandemic, is based on two approaches. What we call restrictive approach and supportive approach. Restrictive approach, let me say, it starts with the limitation, of movement. For example, we have a decree, like a law issued by Moroccan government that there is a suspension of movements of Moroccan citizens and Moroccan also migrants, and very, very limited. And if you want to go out to get to the public area, you need to have what we call as a document, official document, which is signed and stamped by Moroccan authorities to be able to access public area. And this document, I will mention, is written only in Arabic. I will come back to this point, and is very limited you have to have a fixed address, and only limited to a few people, only if one member of family can go outside for shopping and else, and exceptionally some persons that really is should go for the work to be at the workplace. So there are some exceptions. Why I'm mentioning these documents? Here I come back to the situation of migrants. As I said, the 1,500 regular migrants, now most of them are living in urban areas, really overcrowded in small houses, and really they have, most of them have difficulties to have this, let me say, the sheet of paper authorization. Moreover, most of migrants here are from Western Sub-Saharan countries, particularly from West Sahara, Sub-Saharan countries. We have Nigerian, we have English speaking, we have French speaking. As you know, Morocco is the second language is French. We have most of them French speaking, some of English speaking. So really let me say, from the lens of human rights, it wasn't fair. We need another document for these regularized people. They need to go for for work, to have access, for shopping. So there are many difficulties. I'm talking to you from Casablanca. Casablanca is one of the biggest cities in Morocco. It is what we call the economic capital. And believe me, a huge number of even regularized migrants, it's difficult for them to access public areas. Amongst them, I'm giving here facts sharing from civil society here in Casablanca. We have pregnant women. It's difficult, migrant pregnant women, they have difficulties to access to hospital care, to health care. As I said, another figure is that most of the 1,500 of migrants are, they are in the informal sector, informal economic sector. Most of them are vendors, with street vendors working in restaurants, in coffee shop. So now everything is frozen for them. So this is, let me say, for not having these documents, official documents, access to these migrants is really limiting their movement. Most of them, they have difficulties to access, to have financial resources. This is another, here I'm talking, if you notice, I'm talking about social and economic rights of migrants and the impact. So these are one of the restrictive measures that's really impacting migrants in a very, very hard way. There are some interviews, as I said, coming from civil society here in Casablanca, that some migrants, they are telling stories, really talking about misery, it's not a problem if we die. Here we are dying every day because we have of access, of movement. And most of them now, they come back to street for begging. So another problem here, problem due to poverty, and all this is because they have this limited access, documents. Another, let me say, Morocco, let me talk a little bit now about supportive measures. Supportive measures, since the announcement or the launch of the lockdown, 16 March, now we are at the third phase. The lockdown is going to finish on 10th of June. Morocco established what we call a specific national watching monitoring committee that made plans to tackle COVID, and most of the program are addressed to Moroccan and particularly to vulnerable Moroccan citizens. And believe me, there is no, mentioning even in sentences that we have another vulnerable groups who are migrants. So if I come back what we call here the less actively engagement of Moroccan authorities towards migrants in Morocco. Yes, there is a less activities. There is less engagement Moroccan authorities towards, at the level of supportive measures. There is no recognition at the official, discourse. Once again, Morocco has, let me say, Moroccan government has taken some, let me say, supportive in terms of giving support to Moroccan vulnerable group, particularly enrolled in at what we call here the informal sector. So this population, vulnerable Moroccan citizens who have problems due to COVID, they can benefit from some let me say, assistance and some money advantages from Moroccan government. But the condition is to have what we call the medical insurance card. We call it in French RAMED. Le RAMED is insurance health card. If these Moroccan citizens have this insurance card, they can have access to the program of the Moroccan government to get support, material support from the Moroccan government on the basis of having this card. The moment
Professor Zamal, can I request you to conclude, please? We'll get back to you with the question answer session.
I summarize supportive measures. Migrants, they don't benefit even from supportive measures from the government, but fortunately we have civil society which is active. We have churches here in Casablanca and Rabat, and we have the engagement of trade unions. Really it's limited, but we have many activities to support migrants. But really the official support must come from the Moroccan government. And this is why I'm talking about the balance between security and human rights. The future challenges now, for sure that we have a very, very basic economic growth, but what will be the rights of this population? And we have what we call a human policy on migrants and refugees. And now this is the examination to what extent Moroccan government will give and provide and guarantee the rights and guarantee the full enjoyment of migrants here living in Morocco. So there are many challenges in terms of human rights, in terms particularly of socio-economic rights, and the challenges how we can rethink this new policy really to be effective at the time of crisis. Thank you so much for your attention.
You are muted actually. You unmute.
Sorry. All right. We have some students who have raised their hands who would like to ask questions. So that is Raghav, Nag, Firdaus, and Mohan Singh. You can ask the question just after 2 minutes. There were 2 questions from the chat for Professor Bardue from Dominica, and one from Professor Sandhya Mehta. Briefly, Professor Raj, the question is, do you foresee any increase in circular migration between islands after the COVID? And do you see any role of the diaspora helping in rebuilding the post-COVID activities? So that is a question for Professor Raj. And for Professor Sandhya Mehta, so will you see any rule organization accelerate as a consequence of pandemic? And the second is, will GCC accept undocumented migrants after COVID-19? Well, I think Professor Mehta had already answered this question, but you have 1 minute each, please. After this, I request the students, and the second is, will GCC Firdaus and Mohan to come into and ask the questions? Thank you. Professor Raj. Professor Raj.
Okay, thank you. Can you hear me?
Yeah, you have just a minute.
All right. Okay. Hey, the question is, would circular movements between the islands in the region continue after the COVID virus is eliminated? One of the reasons for the circular movement is people are looking for jobs elsewhere. If there is guarantee and the islands accept people, because most of the islands are pretty safe for the time being. But once they open up to tourists, nobody knows what's going to happen. Right now, there's closed down, no flights coming in, no flights going out, no international or local flights. So there's total lockdown here. So if they open up, when the situation improves, that means there is either a vaccine or there's some treatment. Until then, I don't see people are going to happily be moving in and out until such a situation they feel safe.
Thank you.
Now, okay. Secondly, will Dominica, somebody asked me, become a deserted island? No, it will remain. This is a nature island, and there are a lot of old people from Europe and the US who would like to come in and spend their last years. So I don't think we'll become deserted. People will be here. As regards if you give me 1 second, Madam Chair, I wanted to mention that Dominica is not only a sending country and receiving, it's also a transit country, because this is an island country situated between Martinique and Guadeloupe, 2 French departments. So people are in transit here with the hope that they enter Martinique and Guadeloupe, and from there they will enter into France and into the EU. And this is happening. There's a lot of human trafficking here, a lot of human smuggling. So I think this will somehow continue because the border patrolling capacity is quite limited here. Thank you very much. And of course, the impact on tourism and the lives of the people, I don't have to say, we all know, for a tourist-dependent country, poverty levels are actually going up now. Almost 40% of the population is poor, is classified as poor, but because of the wide social networking and the role of the churches and the role of the diaspora, I think somehow people are making do, but how long this will last, I think the chances are not quite, I am not very optimistic. It's a sad situation. Thank you so much. Bye.
Thank you, Professor. Professor Mehta, can you please briefly answer the short question that you have? I think you had mentioned it in the talk, but the question is, will Omanization be accelerated as a consequence of the pandemic?
Yes, I think it will be because I think Omanization, the COVID is going to be used as a kind of a catapult to Omanization, because there are other issues, particularly with the new regime. There is a new sultan, so generally there are various other determining factors because of which skill migration may get impacted. It's not only market, whether there is a market or not is also another issue. The second one was about undocumented migrants. Now, undocumented migrants are not ever allowed as such. They're just tolerated in the country for all kinds of different reasons. People come on a legal basis and then become undocumented later on if their visa expires, and they just go underground. However, enough studies have shown that even undocumented migrants become part of the whole system in all the GCC countries. Oman is really not an exception to that. They will stay on. There's always amnesties. People do take advantage of that, but then others come and replace it, basically because it's mutually beneficial. It benefits both the nationals who get an economic benefit out of the services which are given by these undocumented migrants. And of course, it benefits the migrants in whatever small way. So, yeah.
Thank you, Professor Saya.
Muted. Can you unmute? Can you unmute?
Yeah, sorry. Students, three students had raised their hands. Raghavi, Nag, Firdaus, and Mohan. Can you please ask your questions? Please go ahead and ask your questions, students. Raghavi, Nag.
Hello?
Yes,
Hello.
go ahead. Please, Firdaus, go ahead.
My question is simply, do you see there is a difference when it comes to COVID's impact on different... Oh, hello? My question is related to, do you see any difference between when you see the impact of this COVID or coronavirus on the different continents? When you see the European country has a different, you see it has different impact on me. When we compare it with the African continent, it's totally different. How do you see the difference? Is it real or just it is all because of this media's claims or media's facts that they are putting before us?
Professor Faiz, maybe you'd like to take this question and answer as it concerns Africa. Is Professor Faiz there? Professor Muhammad Jimmy?
Okay. Okay, I'm trying to adjust the microphone. I'm trying. Is it okay now? Is it okay? Can you hear me? Hello?
Yes.
Thank you.
Yes, carry on.
One question I saw written on the impact of COVID. Is it okay? Can you hear me?
Yeah.
Maybe the last question I didn't get properly, but let me just answer another question I saw written down there about the impact of COVID in Sudan on the people from Libya. Libya is a neighboring country of Sudan to the western part of the country. Is a neighboring country, and it is also experiencing so many violent conflicts within the Libyan people. And so many Sudanese people are there in Libya. And the people who are in Libya there, the Sudanese there, they cannot come back to Sudan because the airport is closed. And it has been closed for weeks and weeks. And I think the third wave of the lockdown also is still going on because the airport will resume, I think, only on the second week of this June, of the month of June. So the people, the Sudanese people there in Libya, I presume they are suffering as well from the lockdown and from the difficulties that they face because of the conflict, because of the violence that is going on, coupled with the lockdown and the spread of the pandemic. So these are double challenges for the people there in Libya. Okay, thanks.
Okay.
Can you unmute? Can you unmute? Actually, you keep it unmute all the time because it is taking time. You keep it on mute because you are moderator. Keep it on mute.
Yes.
Unmute.
Keep it on mute. It is still muted. Can I request Professor Lesser to respond so that we can have a round of answer, because we have very less time. I request Professor Lesser to respond the questions directly.
Yes, I received a number of different questions. I want to emphasize that in my research, what we see repeatedly is that existing trends continue and are exaggerated under COVID. We don't see, for example, something that didn't exist previously suddenly appearing. It's not, for example, that racism has suddenly appeared in Brazil. Racism has been a part of Brazilian society for centuries and centuries. We don't see anything new happening, but we see it happening in more intense forms. So we see xenophobia in more intense forms. We see demands for labor to comport itself in ways that don't work in its own interest in intense forms. So that's one broad point I'd just like to make about all of this. It's one of my frustrations with scholarship under COVID, certainly coming out of the public health sector, is that it's often treated as everything started yesterday, but that's not my position. And then the second question I'd like to ask, because I know there are students who are here, and there was a question about data, and it's a really great question about data and methods in pandemic situations as we work with migrants, and especially for people like me and my team who are working in very direct ways. We're not working on policies, we're studying people and their lives in their homes. Obviously, in the very short run, we all have to stay at home when possible, and to intervene in the lives of people is very difficult. But I do think that it's going to be our responsibility as researchers and as scholars to think about appropriate ways to interact with our partners, and that's how I think of the people I study as my partners in the research, to interact with them under these new situations of pressure. Certainly in the case of myself and my team, that will mean continuing to be on the ground on a regular basis. We've been working in the neighborhood for about 6 years now, and it's exactly that kind of long-term, intense participation in the lives of people that creates a scenario in which we can ethically discuss our scholarly work in these very tough times. Thank you.
Thank you, Professor Lesser. Now we'll have two quick rounds by Dr. Jamal and Professor Camelia. So first, Professor Camelia, please respond whatever questions you have received.
I don't see any particular question for me. I don't know if I'm wrong. But okay, I will comment on this question about if the time is right for qualitative. I think the time is right for qualitative data. We can start, gather information all the time. So maybe we don't do field research, but we can do this type of virtual ethnographic, digital ethnography that is always possible. especially if we are talking about migrants who are connected. And the other question that was also general, and I saw in the chat, if we are not overestimating the effects of COVID, I don't think we are overestimating. I think the social life has changed in all the countries that we are talking about. So I see good changes and bad changes, but I see an afterwards clearly different from what we used to do research on. So these are my comments. I don't know if you have any particular question for me.
Now next we'll go to Dr. Jamal to respond. We have very less time actually, so quickly please respond.
Yes, thank you. I just noticed only one question concerning the situation of migrants in the mountains. Let me say not in the mountains, but in some forests, particularly in the north of Morocco. As you know, if you know the geography of Morocco, in the north of Morocco, we have what we call the two Spanish enclaves, Ceuta and Melilla. And these cities, surrounding the cities, there are many forests. And according to civil society in the north of Morocco, approximately 800 undocumented migrants are now settling in these forests. They have no access to food supplies, to help, to even awareness about the pandemic. As I said, there is, suspension of the movement of free movement. So even civil society volunteers, they could not have access to this population. And even this population, they could not leave the forest, to ask for help and support. Really is a big problem for this category. Amongst this, not only undocumented, but according to some social workers at some civil societies, they say that amongst them there are regularized migrants. Some of the 50,000 migrants who were recognized, amongst them, they are now in the forest. They were, before the lockdown announcement, they were nearby the forest to visit some friends and the community. And suddenly after the lockdown, they are now settling there. Really is a very, very hard situation. And let me finish with as I said, if you allow me, very, very quickly, as I said, now the role playing by the civil society, they are more engaged. Unfortunately, the official side, or let me say the government, is less engaged. If we come back to the crisis in itself, it's time now for solidarity, for human values, solidarity, cooperation, volunteeria. To protect and to provide the full enjoyment of all vulnerable groups, not only migrants. Even in Morocco, we have a lot of people living in precarity. So, just in the overall scope of the pandemic, so we need, to keep full enjoyment. We need to push forward, to once again rethink about the partnership between the government and civil society, because this civil society is all the time in the front line, even in time of crisis. Once again, thank you so much for giving me the opportunity to talk, and thank you so much for your, distinguished.
Thank you, Dr. Jamal.
Thank you, Professor.
Okay, please.
Professor Vinod Kadaria wants to make a concluding remark. So, Professor Kadaria, where are you? You're invited. And then we can close, right, Sada?
Okay, thank you very much. It has been very educative and informative. I just want to say that what Professor Lesser said is extremely important, that it did not begin yesterday. It has been, the trends have been there all the time. And as he said, the intensity has gone up. At the same time, I'd like to add that apart from, in addition to the intensity, it has short-circuited. It has become whatever things those were likely to come have come in a shorter time. Like what were the tendencies in Oman or other countries have taken this route because of the COVID. And similarly, we also need to be conscious of the fact that even on the policy issues, policy side, these things have been already happening, and whether this can be an opportunity to expedite the implementation of the policies. And particularly, I would like to refer to, the GCM, Global Compact for Migration, that was signed in Morocco, in Marrakech, in 2018. And if we look at the 23 objectives, then we will find that all of them, or most of them, are relevant and related to the topic of this particular panel discussion about livelihood. And this is about human rights, about livelihood, about making migration safe, orderly, and regular, as it says, and to make it a choice rather than a necessity. And I think that subsumes what Professor Lesser has been said. So there is a compatibility, question of compatibility between the tendencies, the trends that were happening, and what the countries can either do singularly or together. Thank you.
Thank you, Professor. Sadanan?
I think the audio is creating problem. I'll just announce that all the speakers, so wonderful insight you gave, Professor Jeffrey Lesser, Professor Raj Bordoli, Dr. Camelia Tigao, Dr. Sandhara Mehta, Professor Faiz Umar, and Dr. Bahija Jamal. It was very wonderful, and we had very distinguished audience in the panel also, who have shared their views. So now what we can do, we can request our Dr. Divya Balan to propose a vote of thanks formally to everyone. Divya.
Thank you, sir. Am I audible?
Yes.
All right. Good evening, everyone. I'm Divya Balan, and I'm a member of GRFDT. It's my privilege to propose the vote of thanks on behalf of the forum and our entire team. To begin with, I would like to extend our deep sense of appreciation for Dr. Renu Modi. Thank you so much, ma'am, for the well-planned panel discussion moderated by you. We have a distinguished panel of discussants with us today. I would like to express GRFDT's sincere gratitude to all the speakers, Professor Jeffrey Lesser, Dr. Raj Bardoli, Dr. Camelia Thiagu, Dr. Sandhya Rao Mehta, Dr. Faiz Omar Mohammed Jami, and Dr. Bahija Jamal. Thank you for sharing your insights and the excellent coverage of issues related to the livelihood of migrants in the current times of COVID-19 and after. Listening to all of you was very insightful for us. Thank you again to our esteemed speakers. Also, I would like to take this opportunity to place on record our heartfelt thanks to the most valued experts from across the world for attending and contributing to this panel discussion. Professor Chandrasekhar Bhatt, Professor Binod Khatria, Ambassador Manju Seth, Dr. Paddy Sinyanga Knudsen, sorry for pronouncing it so wrong. She's from Zambia. Dr. Renga Warsito from Indonesia, Professor Nashra Shah from Pakistan, and many more. Thank you very much. And all of these names are regular, faces of this panel discussion since the very beginning. We can't really just summarize our thanks in just 2 or 3 words. It's more than that. Last but not least, our heartfelt gratitude to all the participants, without which an online event of this extent is impossible. Today's turnout is 80+ people from more than 33 countries. We sincerely appreciate your time and effort in making this event a great success. It actually gives us a lot of energy and strength and motivation to continue with something like this we are planning actually to continue with this forever. Before concluding, I would also like to announce our next panel discussion. It is on return and integration challenges of migrants during and post-COVID-19. This is on Tuesday, 9th June 2020 at 6:30 p.m. Indian Standard Time. Once again, this is on 9th June 2020 at 6:30 p.m. Indian Standard Time. And the panel discussion is on return and integration challenges of migrants during and post-COVID-19. There is also a very quick announcement. We are happy to invite short articles, book reviews, interviews, seminar and conference report on any theme related to migration, diaspora and refugees for GRFDT's monthly newsletter Roots and Routes. If you have any of your works to get featured in our newsletter, please email your work to convener@grfdt.com. I'll repeat, convener@grfdt.com. You can find further details on our website, www.grfdt.com. Thank you so much. Thank you so much. And I'll see you all on 9th June 2020. Thank you.
Thank you, Divya. Thank you, every participant. Such a wonderful.
Thank you. Thank you, everybody. Thank you,
very
Sardar.
much.
Thank you, sir. Thank you.
Thanks a lot. Thanks a lot.
Thank you,
Thanks a lot. Thanks a lot.
Thank you, everyone.
Thank you, everyone. Thank you. Bye.
Bye, Professor.
Thank you, everyone. Good night.
Thank you.